So good morning to everyone. I'm Johanne Morne. I'm the Executive Deputy Commissioner at the New York State Department of Health, and I'm honored to join you today for a continuation in our discussion as it relates to New York State's 1115 waiver. This is actually session or webinar number 2, following a really great session that allowed for the introduction of our SCNs, our social care networks, related to the 1115 waiver and how we're in fact engaging with people across communities. What is the intention of this webinar? Well, the webinar is intended really to bring together our experts, who I'm going to introduce to you in just one moment. And these experts are from New York's healthcare and social care landscape, exploring how social care networks expand their reach, as well as the impact as it relates to the 1115 Medicaid waiver. So the session is going to dive right into the strategies for scaling up engagement, looking at the opportunities for us to address the social determinants of health, and certainly how delivering comprehensive care to vulnerable populations has a positive and intended impact as we move forward with our implementation. I'm really honored to be joined today with our speakers, Michelle Morazan, the Vice President of Policy and Strategy Development with SOMOS, as well as Mark Ropiecki, the Executive Director for Care Compassion Network. I'm going to tell you a little bit more about them in just a moment. So, I want to encourage everyone as we go through. Certainly, we are here to provide information and offer you updates, but at the same time, we want to hear what specific questions you may have as it relates to your understanding of the 1115 waiver and how you can be a part, or if you're already a part of a network, how you can clarify some areas that you might have questions in. There's a question or a QA option that you have on your screen, and we would ask you to put questions there. We are committed to making sure that we answer as many questions as possible towards the end of our discussion. I want to, of course, acknowledge our hosts, Blooming Health, and thank them again for creating the platform and the space in which we can come together and have these discussions as we all continue to learn about, this next journey or chapter, if you will, in the 1115 waiver, recognizing that the 1115 waiver isn't new to New York State. What is allowing us to move forward, though, is a very intentional core focus on the advancement of health equity. So let me go back to who I'm sharing the screens with today, and I'm going to start with Michelle Morazan, again, Vice President for Policy and Strategy Development with SOMOS Community Care. And in her role as Vice President for Policy and Strategy Development, Ms. Morazan is responsible for all resource development, knowledge management, policy advancement, and a strategic partnership that are there to promote the growth and the impact of SOMOS. Among the many responsibilities that Ms. Morazan has, she develops robust and timely impact strategies in collaboration with various funders, while also implementing programs that ensure the organization's sustainability. She provides multidisciplinary and strategic support to launch critical population health. So welcome to you, Ms. Morazan. Next, I want to just take a moment to introduce my colleague, again, Mark Ropiecki, the Executive Director for Care Compassion Network. And just one moment. I am, my goodness, what a colleague I am, Mark. I'm looking for your bio as well. I'm going to give you the opportunity to provide more introduction to your role and what you do specifically in your position. Why don't I let you do that now, and then we'll come back and get into the conversation.
Certainly happy to. Greetings to everyone. Nice to join you virtually. As Joanne said, my name is Mark Ropiecki. I'm the Executive Director of Care Compass Network, and we're located in the southern tier of New York State. We served as the district performing provider system in the southern tier region, and now also are the awarded entity for the social care network for the southern tier region. And we look forward to sharing thoughts and insights with you this afternoon.
Thank you for that, and thank you for giving me the grace as we move forward in our conversation. So I'm actually going to turn it right over to both of you, and I'm going to start with Ms. Morazan. If you would Can you talk about the New York State Medicaid waiver from the seat that you're in and from the work that you're doing, and really where are we heading? I see that we have a couple technical difficulties there, so I'm going to offer grace on that one. I'm going to turn it to you, Mark, and I'm going to ask you to take a moment to talk about the 1115 waiver.
Yeah, happy to, and it looks like Michelle's back. So Michelle, we're just going to give a quick update on the waiver. We're excited. We've been waiting for this for a while. That this New York State has done multiple iterations of working on this waiver. Going back to even pre-COVID. And so we, as a social care network agency, are in the same position as the stakeholders across the state. We're excited. We've been watching this and. Seeing the RFA come out in January was, very, very helpful to see the direction that the state was moving in. And now we're in a big mode of prep and gearing to get ready. The waiver is very aggressive in concept and also in timeframes. So we're doing our best to wrap around at this point in time the readiness to launch. And I think we're in that launch moment, and we'll talk more about that later. But we're excited by what the state is trying to achieve and what CMS has agreed to in the terms and conditions, and see how this can make an impact in our communities. Michelle, I'll hand to you for maybe an opening remark on the waiver.
Michelle, we don't have your volume. Not able to hear you right now.
Can you hear me now?
Perfect.
Thank you. So thank you for all your grace around the technical glitches. I'm very happy to be here this morning to speak about the work of the Social Care Network in the Bronx and representing SOMOS Community Care in that work. When similar to Mark's remarks, SOMOS Community Care was also a performing provider system during the Medicaid waiver that occurred between 2015 and 2020 that we know as DSRIP. And we see this new waiver, New York Health Equity Reform, as being very important in this journey, as Johanne has said, in terms of making sure that we are expanding our reach and our impact. Many ways, when we think about all the research that we've read about social determinants of health over the years, starting even with research from Michael Marmot, leading this sort of knowledge base around social determinants of health, we have in many ways conceived of different ways in which we could collaborate with a number of different players and diversify the workforce in order to achieve the goal of expanding reach and impact. So we're very pleased that this particular waiver is going to focus on three primary goals. Improving health outcomes, really looking at ways in which we could measure the ways in which the integration of social determinants of health or health-related social needs services are going to significantly impact the individual's well-being. Also looking at issues of equity. I mean, a lot of us in the room, a lot of us here attending today have been having conversations about health equity. We are very happy to see that in this new waiver, that is the main focus, right? Ensuring that all New Yorkers have high quality care, regardless of their socioeconomic status or background. And I think the third primary goal of the waiver is to strengthen the workforce and thinking about the healthcare workforce in a different way. We know that we need to develop skilled and diverse workforce in order to meet this growing growing healthcare system and the demands of the healthcare system. So when we think about the workforce, we're thinking about a number of different types of human resources, including the expertise of those that have been working on the ground directly with our community members that have deep experience in what their needs are, what are challenges and obstacles to their health. So we really are very happy to be part of this process where the social care networks are going to be the cornerstone of the waiver in bringing together a diverse group of providers and community-based organizations to deliver this integrated comprehensive care.
Thanks so much to both of you for making those points and really looking at what are the essential components and intentions behind the 1115 waiver across our state. So in summary, if you think about the overall goals, it really is focused on the advancement of health equity, the reduction, and if I dare say elimination of health disparities, and the support of social care and the delivery of that social care. And so as you've talked about, ways in which we can reach these goals really is looking at and prioritizing population health and health equity improvement, right? I think that we certainly have done significant work across our state in identifying the health disparities, but now how do we meaningfully and intentionally respond to those disparities in a sustainable way? And I heard you, Michelle, talk about, sustainability. Stabilizing safety net providers to support financially distressed hospitals. How do we look at those opportunities again to build and strengthen the foundation of the healthcare systems that we have across our state? The impact and the implementation integration of the social care networks, which is a big part, an essential part of our discussion. And then thinking about, primary care models and prevention. Prevention is really key. If we can prevent, then we can focus on some of the other areas that certainly people talk about all the time as being essential to their ability to achieve their highest level of health. So the social care networks, recognizing 9 organizations statewide. And also I just want to make the point, there are significant resources that are behind the health equity, or excuse me, that's how much I think about the 1115 waiver, right? I use the terms interchangeably, but really in many ways, I could say that in the Department of Health, when we talk about the 1115 waiver, we see this as very foundational to continuing to expand and enhance the work that we historically have done and prioritized related to health equity principles. So let's talk about lessons learned. A lot of times when we're in conversations, and we're coming up with new ideas, and who sits at the table is often changing. What are some of the lessons learned about the past waivers and past work that we've done that we think we can build on as we advance in today's conversation? Let's start with Mark.
Yeah, I think having worked in the previous waiver, a big lesson learned is the criticality of including the community voice in the development of a community-based approach. And one piece of the work of the social care network is it's going to be forming a functional community-based network, I'll call it, or a regional network that's going to jointly work together to achieve a common outcome. And that can't be a top-down approach. That has to be born and supported out from the community. So, if you're an organization that is interested in working with a social care network, I'd encourage you to pay attention to what are some of the community-based focus groups or councils or advisory committees. I've heard of a lot of them, sort of being formed, and they're all called different things, but I've heard of a lot of those commonly being used as a way to inform the social care network about how to organize around delivering of these services. The services are standard statewide, so that you're not going to see variation in services from region to region. But what you will see is how can those services reach the community and each community having different needs. So a lesson learned that I think worked really well from the district program was community collaboration and finding who to work with. And I'd like to see that continue and to be built on in this new waiver as well.
Community collaborations are key, and recognizing the experts and the expertise that we have in community-based organizations is really essential. Michelle, I want to pose the same question to you. What are the lessons learned from your experience and the work that you've been doing?
Well, we were very pleased to be part of the district process. And I think what stood out as unique for us, and that really lent to the lesson learned and sort of like lending to what Mark was talking about, is that collaboration with all types of providers, including community-based organizations, really led to the significant improved health outcomes. In our case, SOMOS Community Care is a network of independent providers, a bulk of them being primary care doctors. We have over 2,500 providers in the downstate area, mostly in 4 boroughs of the city of New York. And we saw an incredible amount of collaboration between primary care doctors and the neighborhood-based community organizations that provide social services. So that was very key, and that's why we're very happy to see New York HER sort of allowing for an expansion of that impact. I think the other thing that we learned, which was something that we also felt the sort of significance of, especially post-waiver when the pandemic hit, was that SOMOS had always put a member-first approach into everything we did, and just making sure that the members and the care they received was at the heart of everything we did. And the community members definitely feel a difference when you're speaking directly to them and asking them about their satisfaction, ways in which they envision themselves participating in a model, and just getting preferences. I think that the cultural and linguistic competency and humility was very important to the success that we saw during district, and we hope that we will continue to see such effects during the New York HER waiver as well. I would also say that the geo-segmentation that we're trying to achieve in this waiver was also very important, because when we started district, we did a lot of community needs assessments, and we were able to target specific communities that had suffered from particular disparities. And we honed in on those and made concerted efforts. And because we were able to collect the data at that level in terms of the geo-segmentation, I really do think it helped us achieve significant, health outcomes and improvements.
Absolutely. And certainly by looking at that geo-segmentation, looking at those communities that show the greatest disparities, in spite of the fact that there are any number of services, right? It calls into question, what is the definition of access? And how do we sometimes have to change the model that perhaps has worked in the past in order for us to be able to actually reach individuals in a meaningful way. So that being said, Mark, what are some of the funding opportunities that are available under the waiver? And in particular, how do community-based organizations who we know have always been sort of the expert and the front line in the delivery of social support services, how do those community-based organizations become a part of the conversation, and what can they expect in this waiver?
Yeah, it's a great topic. It's a big one. I'll try to focus in on the top thoughts here. First, a lot of I'd give like a side commentary on the status of contracting in the landscape, because that's sort of the predecessor to a lot of the deployment of funding out in the community. And if you're feeling left behind because you don't have a contract with the social care network in your region yet, fear not. None of the contracts have really been released yet. We just had our meeting this morning to finalize it, and we're going to be starting to roll our contract out just today. It is a standardized contract that the SCNs are working with the state to push out. So if you're not contracted, you're not alone. I would dare say no CBOs are contracted with any SCNs at this point in time, but that will be picking up very aggressively over the next 2 to 3 weeks. So be on the lookout for those contracts. However your SCN communicates it, whether it's on their website or on a newsletter or a webinar, that would sort of be the starting point for most of them. But there's 3 different types of funding that I think are helpful to think of. One is the infrastructure funding. Another one is direct reimbursements for enhanced services. And then a third one that's important to keep in mind is funding that's available through the WIO. There's these workforce investment organizations that do have funding that can support things like CHW training and things like that. So please don't forget that there is also funding through this waiver for the workforce. And not to say that the SCN can't also provide workforce funding for CHWs and other positions, but there is also an entirely dedicated workforce initiative hosted by 3 workforce organizations. I do see the chat. The third funding is the WIO. We call it the Workforce Investment Organizations. And those just recently have been announced, and we can share their information after the webinar. When it comes to the infrastructure funding, this is a very time-bound, limited resource pool that's meant to stand up the social care network to be able to provide services. So there's some infrastructure that would be required on the SCN side of things, whether it's the closed loop referral operating IT system. There's also Medicaid member. The social care networks have an obligation to do member-facing websites and different communications. But also investments directly in community organizations to maybe staff up to provide services in communities where there's not services, expand the scope of interventions that maybe can increase capacity or expand regions that they're provided. So there's a lot of opportunity from the SCN with regards to the infrastructure funding to really pivot and meet the local needs of the communities. When it comes to the enhanced services, those are things that are going to be much more scheduled and sort of finalized by the state. And there will be, it's not published yet, but a defined fee schedule. It says for this intervention, here's a defined payment amount. And those will be coming out probably, I would guesstimate within the next 2 to 3 weeks. It seems like those are nearing completion. And those fee schedules, I think, are what a lot of organizations are looking for because they're sort of paired together. Infrastructure funding can maybe help you get a position or make an investment to build up services and capabilities. However, you would sustain that with the payments that you receive from the enhanced services for providing interventions with the Medicaid member. So you sort of have to do some of that pairing together. So more of the funding will be released in the near future. And one other side of the funding that I don't think many people have visibility to is it's not waiver funding that's coming to the social care networks, but it's funding that New York State is investing in on a technology basis in the background. So there's an entire IT system that I'll speak about later that the state is making profound investments in that really speak to how this gets woven into the Medicaid landscape. So there's a lot of different opportunities. And I think what I've seen a lot of the social care networks doing in terms of how does an organization apply? How do I tap into this? I think the first step is going to be contracting with your social care network and starting to make that outreach and engagement with them. And then understanding how are they deploying their funds. Most social care networks are having early adopters and initial waves of engagement. But we're also looking at making sure we invest in large organizations and small organizations. So that is a targeted metric that the state is talking to us on. So the social care networks are monitoring that and making sure that we're making distributions across the communities and across a variety of organization types.
Thanks so much for that, Mark. I mean, that's really, really great information. And, so to build on that, Michelle, I'm interested in knowing how are the social care networks, the community-based organizations, other stakeholders, how are they beginning to prepare for the 1115 implementation?
So when I think about the community-based organizations that we're working with, I also think about it in terms of like, what is the general context that we're seeing for the environment in which the community-based organizations have been working? So, like actually New York actually has the 3rd highest level of registered nonprofits in the entire nation. I think we have nearly 118,000 nonprofits registered, and they all provide a variety of different services. I would argue that a lot of those organizations across the state are working towards improving health in one way or another, improving health and well-being. So one of the things that we think a lot about here at SOMOS when we're thinking about the community-based organizations that we've worked with since 2014 or the new groups that are coming in and being part of the social care network is that it's a big shift from normally receiving contracts or government grants, foundation grants for a specific program that you may never have seen, or the community-based organization may never have seen sort of like as a health program. So that's one of the first things that we sort of like talk about with the community-based organizations that we are engaging with. I think for a lot of the community-based organizations, we are trying to educate them as far as like what our vision is for the social care network and what our experience was in the past working with community-based organizations. We are advising all community-based organizations who want to work with the social care network in the Bronx or any other borough or any other region across the state to really start thinking about their interest in participating in the program, and understanding that this is going to be not just a 31-month project, but we really see a longevity to this. So we really see an advantage for the community-based organizations to enter into this space. And to think about this not just as a way in which to enter an industry where they're going to be able to get fees or funding for services that they've already been performing, but not funded through federal funds, but also as an opportunity to collaborate with other providers. We are emphasizing the opportunities to work not just with preventative providers that are in the field, but also providers that are working with individuals that have already been heavily impacted by historical and structural inequities, et cetera, and are very at high risk. So we're looking at what are ways in which that collaboration network can be built and really sustained through the social care network. We are also doing a lot of work with the community-based organizations around their technology platforms, because we have learned in the past that the technological infrastructure is so very important. That IT is going to really put everything in place to support the program. And we know that there's varying levels of infrastructure across the social care network CBOs that we're working with. Some have very little infrastructure and some have very sophisticated infrastructures. And they're wondering, do I need to now stop subscribing or using a particular software system because now I'm going to be using the social care IT platform that we selected. And in no way do we want that to be disrupted. As a matter of fact, we're making concerted efforts to make sure that there's connectivity between whatever platform they're using for case management or intake process, et cetera, and Find Help, which we're using as our technological platform for the social care network. And I think looking deeply at what the staffing looks like at those CBOs, do you have the kind of staff that is going to be essential to delivering the enhanced services if you want to be in that space? And also thinking about, do you have the staff, administrative staff, to really think about the reimbursement basis, the billing, like thinking about what kind of evaluation sort of mechanisms we put in place over the course of the development of the social care network. So we're very happy to be working in collaboration with the CBOs and having those fluid conversations back and forth. And like Mark said, our approach, and I understand that the approach across the state, is that this is not this is not a system in which only some CBOs get invited, but we want to really see most CBOs that are interested in being part of this to be able to come in, get the support early with the infrastructure funds, and then we continue working with them across the different phases of the project.
Michelle, thanks so much for that. Mark, get ready, because I'm going to come back to you in just a second to continue the dialogue as it relates to IT and technology. Michelle, a question that came in from the chat: how many multi-provider practices located in the Bronx are joining your social care network?
I would not be able to give you a specific figure, but I could get back to whomever posted the question with the answer.
Okay, that's great. So I'm going to look to my colleagues at Blooming Health to take that on. And I already see them in action. See, that's what Blooming Health does. They link, they provide information and the resources. I'm just going to take a moment. So there must be something good going on here, because I continue to see the number of participants going up. For anyone who has joined late, I just want to take a moment to say welcome. And also just to do a check-in for anyone who was not on in the beginning, we're joined today by Mark Ropiecki and Michelle Morazan. Michelle is from SOMOS, Vice President for Policy and Strategy Development, and Mark is the Executive Director for the Care Compassion Network. So thank you for joining, and thank you for being part of the conversation and talking about and exploring how social care networks are expanding their reach and their impact as it relates to New York State's 1115 Medicaid waiver. Okay, so Mark, I promised you, and here I am. I want to talk a little bit about technology and IT. What data will social care networks, community-based organizations, healthcare providers need to collect and report under these new waiver guidelines?
Yeah, happy to talk about IT, and I'll preface it by saying I'm not an IT credentialed person. I hold no skilled background in IT, so I will speak in generality around this. But IT at large is going to play a really critical part in the waiver. And I hinted at it earlier that New York State is taking a really strategic approach around how they're structuring the social care networks into the web of IT platforms that already exist. There's a lot of investments and uses that the state has used with the RIOs or the QEs, with NICE and many other systems. And the state is very intentionally saying your system that you use, and you're going to hear a lot about Find Help Now and Unite Us. That's basically the two key platforms being used across the state for this waiver. Those systems are being integrated from a social care network perspective, integrated to the existing state infrastructure and new data lakes and these sorts of things. So the social care networks are not just being structured as let's patch them as isolated networks. They're being woven together on the back end. So there is a statewide view about the work that is done. So when you talk about the data that is going to be captured and gathered, that data will be available to the social care networks to monitor their progress and issue payments and all those kinds of things. And it's also systematically going to be woven together at a statewide view, so we can see as a state, how are we doing for other people that reside within our state. When it comes to the data itself, there is a lot. And what we're really aiming at is that these IT platforms can greatly simplify the work that the CHWs and the social care service navigators need to do. There's billing components, there's Z codes, there's modifiers. This is a Medicaid program, so you're getting into Medicaid billing in a CBO setting. And we're trying to set these systems up so that CHWs don't need to be coding experts. CHWs can do the work that they do very well and engage and spend their time with the Medicaid member. But the systems themselves are going to be capturing and monitoring data elements like consents. This is PHI potentially level information, and so there are consents that are required to capture and record data within the systems. You get into the result of the screens. You hear a lot about health-related social needs screens. Those screens are so critical because an individual could be eligible for an enhanced service. They could have a need. We could have a network organized and we're reaching hard to reach and unengaged individuals. But if they don't take a screen, they're not able to access those. So the screens, the effectiveness of the screens, how an individual answers those screens is like one initial critical gateway as to how a social care network can make the services available to them. So effectively documenting those is going to be a really important step. But the systems also will be capturing, hey, I see a Medicaid member. What SCN do they work with? Well, are they eligible for services or not? There's qualifying groups and clinical conditions that are going to need to be understood. And the data systems are going to be capturing all of that on the back end so that when a CHW or a navigator is working with somebody, they can do a screen and make those referrals. And then on the back end, there's the billing. People get reimbursed for these things. So the systems are pretty complex in terms of what we're asking them to do. But there are, and again, from the community side, you wouldn't see this. The social care network teams are meeting weekly with all of these stakeholders, with the RIO, with NICE, with the platform developers and the Department of Health, to make sure that this very complicated framework gets put together. And the vision is that data capturing and processing gets more efficient as we go forward. So we might start with some data feeds that are maybe done on a weekly basis. Maybe we can get it to every other day basis. But the teams are working, the IT teams are working very hard in the background to make that possible. So there's a lot that's being placed on the shoulders of IT. It's sort of a backbone of what drives all of this. But there's some very smart and very technically sound people that are working on it on the back end. So more to come on that. And I assume if you have any IT experience and you can raise your voice, that's very, very helpful for the social care networks. Hey, this isn't exactly working for me. Here's this barrier that I have with my organization. That's an exact use case for where some of those infrastructure funds could be deployed. Let's make sure that your organization has the technical capabilities to be able to interface with this system. So that's just another plug on how customized the infrastructure funds can be. Yeah, Michelle.
I wanted to agree with everything you just said, Mark, because I also am so happy to have such a dedicated and thoughtful group of people who are working on IT and data collection at SOMOS. They're absolutely magnificent. I think even before we started the webinar, I was bragging about them because I think they're amazing. Because one of the things that we need to think about this is really implementation science as well, right? When we're thinking about the social care network, we're trying to figure out how do we develop this model and how do we create feedback loops along the way to make sure that this model is actually going to be successful over time. The data that the IT team is collecting on many different facets, all the facets that you outlined are important. The other kind of data that we're collecting is what is happening with the CBOs in terms of their capacity. We had this number of CBOs, these are the network characteristics at this date. What have we inputted, right? What were the activities that we did with the CBOs? And as a result, what were the outputs and the outcomes? Because really, when we think about it, we're going to see a lot of screening information. We're going to see a lot of demand for services. We know that demand already exists. How do we make sure that the service demand is met with capacity on behalf of the CBOs that are now going to be delivering health-related social needs services? So we're looking at interdisciplinary and multidisciplinary ways of collecting data. Yes, member-facing data around how even the interconnectivity works, but also how is this truly benefiting the CBOs?
And the SCNs will be a big resource to the CBOs, whether it's training, it's onboarding, I dare say, help desk support. A lot of that organizations can rely and turn to the social care network because they're going to be helping, toggle all these things. It's going to be a learning process. This is a new waiver. It's a demonstration. So it's not all going to be perfect right out of the gate, but the social care networks are being built to support the CBOs and as they onboard their staff and start to deploy the services in the community. And the target is to be doing this starting January 1st. So when I mentioned rapid timelines and contracts just coming out in the next 2 weeks, there's infrastructure funding, there's system adoption and system interfacing. So that's really, if I were to predict the roadmap for November, December, it's going to look a lot like that.
And just if I may, I want to emphasize it's very important to make sure that we are all collaborating. All of the stakeholders in this ecosystem are collaborating. The strength of this program is based on the strength of the ecosystem members and the way in which they are communicating, sharing findings, making adjustments, coming up with quick and clever solutions, and being innovative together. So please, let's collaborate. Let's make sure we create systems for collaboration that are sustainable.
Michelle, thanks so much for that. And Mark, thanks so much for your comprehensive response. I often remind people here at the department, I'm a data end user. And so that means I have a lot of respect and admiration for everyone that works behind the scenes to make it all happen because it is complicated. And the reality is data is very significant to the work that we're doing. Number one, it's the opportunity to show the evidence of the outcomes that we're able to gain. And number two, it allows us to really, as you were talking about earlier, Michelle, identify those areas that we need to focus on. It's one thing to celebrate the successes or advancements that we see. It's as important for us to make sure we're using data to identify those gaps in a meaningful way so that we can respond in kind. So thanks to both of you for that information. And certainly I would imagine that for the participants, understanding the amount of support and the resources available and helping to look at what are the existing systems and how do they integrate and align or not with what's going to be needed as we move forward is really key. So no surprise, we have a number of questions that have been received and are coming in. And so I want to just sort of walk through some of these and try to answer as many questions as we can. And one of the first questions is to ask about how are you ensuring equitable access as well as the quality of service or care that social care networks are looking to scale up or expand, if you will. And Michelle, do you want to start?
So the network that we have been working with is a mix of primary care providers and community-based social service providers. We've been having this network grow over time since 2014, 2015. And what we're really focused on is making sure that the member experience is one where they feel acknowledged, where they feel respected and understood. So that's the first thing. We're very interested in making sure that we have the data to support that the members are happy. But also in terms of the quality of care, there has been a number of initiatives at SOMOS to provide capacity building for all providers. And a lot of this focus during Disrupt was around some of the population health management programs and the ER admission reduction goal, right? But that same infrastructure around building capacity for all providers has continued. And that means that the SOMOS team is supporting providers in looking at the data. What does the data tell us in terms of whether or not this person has been screened for such and such service, or there has been follow-up, or that we have touched point with that member to make sure that they attend a follow-up meeting or appointment, etc., and monitoring the outcome through the data systems that we have in place. We hope that that will also be very beneficial to the social care network CBO providers that come into the ecosystem, because we want to see how we have been able to sort of mirror the same kind of outcome with a new group of CBOs. In the past, the way in which we monitored the CBOs and sort of made sure that there was high quality was by having direct contact with the CBOs. Deploying this community health workers and also our community engagement team to go out to the CBOs and see really what is happening, how can we enhance, where can we provide more support. We hope that now with the infrastructure funds that are available through the social care network, that we'll only be able to make that more robust and more systematic over time. But we want to make sure that we are very agile in terms of the way in which we respond to the community-based organization's needs. We don't fully know, right? This is all new. We don't fully know what the CBOs are going to need as they enter into this space. So we have our ears and eyes open and very willing to accept all sorts of information and also seeking that information. Because in truth, what we want is to make sure that all providers in our network are strong, feel capable, and are giving very high quality care to the members.
Thank you for that. Mark, I want to turn to you and build on what Michelle has said. Michelle, one of the things that I've noted through many of your responses is you really emphasize collaboration. You emphasize collaboration, which to me talks about networks, and you also have said on more than one occasion sustainability, right? So Mark, if you would, I want to talk about or ask a question on, you know, how are the service providers who are not necessarily not-for-profit, not a 501c3, who are looking and working in different sectors or areas of the community, how are they included in this model? And if you would, just to help us expand and think about what is the network?
Yeah, it's a good question. So the 501c3 organizations that provide local services are those defined as CBOs. So when we're talking about CBOs that are working with the social care network, that's how they're defined in the state documents. So there is a priority preference that the SCNs must give to the not-for-profit 501c3 CBOs, but the SCNs are permitted to work with for-profit service providers, and there are many of them across the state. And there's just a process that the SCN would have to go through, like an exclusion process, to get those submitted and verified by the state. So there is a starting point with the C3 CBOs, and then where there's gaps that let's say a C3 can't meet, but there's an existing service provider and they happen to be a for-profit, they could be engaged by the social care network. They just have to go through a verification process, which is very simple. It's not a complex thing to go through. So we do expect to see that community by community. So there is variation with regards to where services exist and who provides them.
And so for our participants, who's part of the network and who are we collaborating with seems to be really a very key question, because the next question I want to ask, where do federally qualified health centers play a role in these networks? And I'll open that up to both yourself and Michelle.
Sure, yeah. Federally qualified health centers have a big role, minimally in the ability to screen Medicaid members. There's a lot of back and forth questioning on how they already get paid to provide screens, and there's some technical. If you are an FQHC, there's like a technical conversation on, yes, you could screen, and here's how some of that would need to be documented. But we do have verification that the FQHCs can participate, they can engage, and we just have to make sure that things are documenting and not duplicating existing reimbursements that they're getting.
Thank you. Michelle, did you want to add to that?
Same answer. The addition would be that the emphasis has to be on prevention. Expanding impact and reach also includes prevention. So we see medical providers, including FQHCs, as very important partners, although they're not typically considered a CBO in this instance. They're very important partners for us to work with in this ecosystem to create ways in which we can focus on prevention through this work. I think that we also see a number of for-profit providers that are coming in and being considered to be part of the network, because there isn't enough capacity building around some of the specific HRSN services that are needed in New York. For example, transportation CBOs in the downstate area are very scarce. So we are looking at what are some for-profit providers that can step in while we build the capacity of nonprofit providers to step in and provide that kind of service. So I would say the first response in terms of FQHC, we see them as important partners in prevention. And then the question of whether or not there's a funding possibility, if they're already receiving federal funding for some of the services, then that's something that we have to look at case by case. And as far as like other for-profit providers, we think we need to consider possibilities of including for-profit providers where there's still an area of very strong development need amongst the community-based organizations.
Thank you. You know, Mark Ropiecki, Michelle, Morazan, we've learned a lot today from you and from the experience that you've had really in working in your networks and in helping us understand exactly where the 1115 waiver offers opportunity. And really, I just want to emphasize, you know, if you think about the responses that you've heard and your understanding of the 1115 waiver overall, there are themes. Advancing equity is a top priority of this theme, and recognizing that everyone has the right to access to healthcare and to live their fullest, healthiest life. Access to support and care, looking at the opportunities of reducing stigma, anti-stigma efforts, and the promotion of human rights, because we know that healthcare is a right. I want to say thank you to both of you, and I want to take a moment now to turn it to my colleague from Blooming Health, who again is our host for today's session, as well as a series of sessions that are happening as it relates to increasing our understanding of the 1115 waiver and the impact that that can have across our state. One of the questions that has come up from our participants really is understanding and knowing exactly the mission and the vision around Blooming Health and who our host is. So I'm going to turn the screen to you. Thank you, Kavita.
Thank you so much, Johanne and Mark and Michelle, for all the valuable insights you all shared today. Want to echo what Johanne is saying, like we at Blooming Health have been organizing this 1115 webinar series. This is the second in the series. So to introduce myself, I'm Kavita Gnanasamanthan, co-founder and chief commercial officer of Blooming Health. And at Blooming Health, we are a technology company focused on empowering community-based social health. And we've been doing a lot of thought leadership around the space, but essentially at core, we are a technology company that's empowering community-based organizations. Hence, the whole 1115 waiver is very close to our heart. And especially, I'm excited about how it's bringing together diverse stakeholders from across the space, as we talked about in terms of the social care lead entities, the CBOs, the various FQHC providers, the MCOs, and others. And we can see that in the audience today, the webinar. So briefly, to introduce who Blooming Health is, I want to start with the overarching North Star for the 1115 waiver. The key goal for 1115 waiver is to advance health equity by reducing health disparities. And one of the North Stars is to screen all the 7.3 million Medicaid members for health-related social needs by March of 2027. And this is very obvious given the objective of achieving health equity. We want to reach all the members regardless of where they are. And the key objective also here is to improve the capacity around this, as we've heard both Michelle and Mark talk about this, especially around the social care infrastructure and linking the preventive care with how we are doing the sick care today in different circumstances and environments. And also we want to make sure it's accessible to everybody, regardless of where they are and what language they speak and what cultural backgrounds they come with. And the key challenge we face here is around how do we reach and engage the Medicaid members. So at Blooming Health, we work with 900 community-based organizations across 17 US states and are reaching 350,000 members. And through that experience over the past 4 years, we've realized that a key aspect of reaching members, especially underserved members, both in rural and urban areas, is around the technology divide. We know at least 20% of the Medicaid members in New York State lack reliable internet access. It's particularly high in low-income and rural populations. We know 22% have limited English proficiency and are coming from different types of, again, ethnicities and backgrounds where we need more broader education and literacy. And there's also a historic mistrust in this population around healthcare. So anytime we're introducing a new initiative like the Medicaid waiver, we need to think about how do we leverage existing trusted relationships in the community to reach these populations and engage them with the initiatives. So that's where Blooming Health comes in. So we are a simple, scalable member engagement solution that's been co-designed with community-based organizations, and it's designed for SCNs like social care networks and their member community-based organizations to reach Medicaid members where they are via text, voice calls across all types of devices and in 80 different languages. And we are building on the existing trusted relationships of the brand of the CBOs like Catholic Charities or the County Office for Aging or the different SCN lead entities. And we are helping them to expand the capacity for the social care navigators and the human workforce that they are building by automating some of the routine and repetitive tasks around communications, and also streamlining the outreach and survey capabilities for evaluating whether the member actually received the service that they were supposed to receive and how did they like the quality of the service. So we are a key partner around member experience from the get-go as the SCNs and the CBOs are collaborating and setting up the processes around that. So I'm excited to share that we recently announced a partnership with the Western New York Integrated Care Consortium in Western New York region. And Nikki Kaminsky has been an amazing partner and an innovative leader in this space, both in aging and in other populations as well. And you're welcome to learn more about us at the website, www.gobloominghealth.com. And you can also scan our QR code here. Thank you once again for joining us today. I want to again thank Johanne, Mark, and Michelle for the time you spent with us today, the very valuable insights you shared with us and the audience here.
Thank you so
Awesome.
much.
Thank you. Have a wonderful day, everyone. Bye-bye.
Thank you.